Everybody to today's meeting. We're glad you're here. I think we'll have a few more people still joining us, but happy summer. We're officially in it now, which is crazy to think that we're already at this point in the year. So we're going to jump right into today's agenda. I let's see if I can advance my slides. There we go. So our agenda today is we'll start with our announcements, and then move on to our case share and brainstorming, and then move into our learning session today, which is going to be all about refugee and immigrant health, and we're really excited for that. And then we'll have a little bit of time for questions and wrap up at the end. So just to give you a little overview of what's happening today. If you'll take a couple minutes and rename yourself in your Zoom profile, we want to be able to make sure we know who's all attending this meeting. So if you are able to see your picture within Zoom up in the upper right-hand corner, there's three little dots. If you'll complete your name and add your agency, that really helps us for taking attendance for this meeting to see who's here and reaching out to those that are maybe new. If you are joining us for the first time, we would love for you to drop your name, the agency you work for, and your email in our chat box as well. That way we can make sure to add you to our listserv and the meeting invites for the future as well. So for our announcements today, since our learning session is on refugee health, I thought I'd highlight a few things around refugee health. So one is that it is World Refugee Day on June 20th, and some ways to get involved with that, here's some ideas for ways to be involved in that. So there is a celebration happening and hosted by the Utah Department of Workforce Services this Friday, and that is at Big Cottonwood Park. And again, all these notes will be linked in all of this information will be linked in the notes I send out after the meeting. So you don't have to worry too much about scrambling to write anything down, but just some ideas about ways to participate in World Refugee Day. You can attend a local event, or look for ways to volunteer with organizations such as the Utah Refugee Resettlement Program, or international organizations like International Rescue Committee, or just educate yourself about some more things related to refugees and immigrants. This is a linked NPR podcast series named Resettled, which features stories about refugees adjusting to life in the United States. So just some resources that are relevant to today's learning session that we'll have. And then we had a case share today from Abby. Let's see, I have not seen her on yet, I don't think. Abby, are you with us? Okay, I haven't seen her in the participant list yet. So we will move on to our brainstorming and come back to her if she joins us in just a second. So does anybody else have any cases, resources, updates you'd like to share? This is your time. Somebody has their hand raised. I'm sorry, my view is a little bit different today, so I'm not seeing.
It's me, sorry.
That's okay. Go ahead. Go ahead,
Yeah,
Carrie.
I don't know if you guys know, but I'm the chair of the Parent Engagement Support and Education Subcommittee for the ECU Advisory Council. And we have 8 actively participating parents that are on it. And after every meeting we have a little debriefing and they get to ask other questions or provide additional insight that they maybe didn't want to during the meeting. And so this is where I get to the question for this group. Um, One of the parents brought up how wonderful it would be if on a really rough day they could call like a chat line and just vent to their girlfriend, right? Like to vent to some other person on the phone. And I am unaware of any resource like that where it's not like, oh, you need mental health or you need assistance or you need something and all you are wanting is really just to talk to another parent and kind of talk through the day and then say, great, have a good day, see you later, bye. And if any of you guys have a resource like that, please send it my way. I'm doing research myself to see if I can't find something, but so far I've hit a wall. That's it. Thanks.
Carrie, I would say, I mean, are they specifically wanting another parent to talk to or just somebody to talk to? Because that's really what 988 is. And actually, they've been trying to dismiss a lot of myths about it regarding like it being only for emergencies and things like that. Like 988 is there for people to call and talk to. Um, and so they can call and talk to them and just debrief if they've had a really stressful day. But if they're looking for a parent specifically, I haven't really seen any resources like that.
Yeah, we brought up 988 and specifically they were like, we just want another parent that maybe is also having the same day or, we could just sit there and vent and then say, okay, great, go have dinner. Bye. But we'll make the suggestion again and again, share the flyer and stuff. But thanks, Haley.
Carrie, it's Heather. The Utah Warm Line, have any of your parents used the Utah Warm Line? It's, I'll put it in the chat. It might be something that you're interested in. It's not necessarily parents again, but it's more for, hey, let's just talk. And I've had a couple of parents call it and actually feel happy about it. So I'll put it in the chat.
Thanks, Heather.
I would also maybe explore Facebook groups or like any specific groups out there for parents and see if there's space, or I'll keep an eye out if there's support groups for parents and that are virtual.
Those are all really great suggestions. And I'll make sure to link those in the notes as well, some of those resources. Okay, I think I saw that Abby came on. So Abby, did you have a case to share with us today, Abigail? I thought I saw her. Maybe that was yeah, she's on. Let's see if I can maybe if I can make you a co-host, Abigail, you can share your case with us. Maybe, maybe not. Hi, Abigail, are you there? Okay, well, maybe we're having some technical difficulties. Um,
Can you hear me?
yeah. Oh, yep, we can hear you now. Abigail, go ahead.
Can you hear me? Okay.
Yep.
Okay. Awesome. Yeah, so the case study that I had was just a few months ago. I had a family come in. It was a single mom who was not from here and didn't have citizenship, and her daughter has really significant autism, but since they've moved here fairly recently in the last 5 years, she wasn't able to get any testing done, just given her own status in the country. And, you know, I told them about the resources out there for refugee children and even refugee families, how they can get health care. And, you know, nothing bad would happen to them. And she still just was so nervous and so scared to even submit an application. So that was kind of the experience I had. And her daughter really needed ABA therapy, but without a diagnosis or like formal evaluation, no one would take her to do ABA.
And did you find any resources in particular for this family, or you're still looking for resources?
I'm still looking. I'm still working on that. I have been in touch with the mom, and she's just kind of like, yeah, I haven't found anything either. So we're just both looking, especially because a lot of that stuff goes through insurance.
Mm-hmm.
And the mom is kind of saving up money to just pay out of pocket to go somewhere and just pay for an evaluation and then eventually pay for ABA therapy just in cash, which we know is really expensive.
Right. Yeah. Does anybody have any resources for Abby?
Have you reached out to the Children's Center?
I think this kiddo is a little older than 6. Would they still help?
They should be able to help.
Okay. Yeah, I could reach out to them. That's a good idea.
I believe that Primaries just opened a ABA clinic. I'm not sure what resources they have, but that might be another option.
Oh, awesome. Maybe they would know somewhere to go to get an evaluation for.
And they
those who
also
are not-
have the ABA services too. So I wonder if they might be able to help with the finances.
Okay. Awesome. Thank you. Thank you, guys.
Sorry, I'm just going to throw in that sometimes the Autism Council of Utah gives grants. You could reach out to them and see if you could apply for one. There's also that Ezra B. Smith Foundation grant that offers some grants, especially to those without the funds to pay for it for ABA.
Yeah.
And then I'll keep looking. Maybe I can share with Athena later.
Awesome. Thank you. I didn't even know about those.
There's Parents for Children, run by Carolina Barra, and it's specifically for Hispanic families. And the website is parentsforc.org.
I'm going to dogpile on Haley. They do virtual classes and like parenting support groups, and as she said, offered in Spanish.
Oh, that's awesome. Thank you.
It looks like somebody put in the chat too that she could look at the Utah Developmental Assessment Center as well and potentially apply for financial assistance.
Okay.
Lots of really good options. And again, I'll make sure these are all the resources are linked in the notes that go out. This is the
Yeah,
power.
thank you so much.
Yeah, this is the power of this group. So please bring your cases like this to this meeting. I think it's really a helpful place to brainstorm ideas for difficult cases. Okay, so moving on to unless anybody else had any case shares or announcements you want to share with us.
Athena, this is
Yeah.
Brooke Christensen with Utah Valley Pediatrics.
Mm-hmm.
I actually had a provider ask recently about any sort of billing code that we could use for the time they spend preparing for new patients that are really complex. A couple of our providers have brought up that they're spending hours preparing. One of them recently said it's been like 3 hours getting ready for this patient's visit, going through specialist reports and previous records. So I'm just not sure if anyone has had any success with a specific billing code for this type of situation. I know we've talked about the care
Yeah,
coordinator code before, but I'm not
right.
sure if there's a code providers can use.
I know there are some longer assessment codes. I'm gonna have to look into it a little more, but I can probably try to send you some after. But are there any other practices that are billing for extended visits and having success with reimbursement? I think that's the the harder question. You can always bill for it, but the success for reimbursement, I'm not sure on.
Yes, and we weren't sure if they had to be face to face with the patient to be able to
Yeah.
bill for it. I know some of the longer ones you have to be actually in the room with the patient um, to bill for it. So I wasn't sure if there was any type of code that was utilized for just preparation for those.
Let's see. It looks like somebody wrote that the comprehensive care clinic uses complex care codes for provider billing, and it says Jason Fox will be able to share more details. So I can connect with Jason. I he probably would be the best person to talk to. So I'll rally with him and see if I can get something to share over the listserv or in maybe as an update in our next meeting around that.
Perfect. That would be great.
Okay, great. Thanks. Okay, we're going to move on to our learning session. So for today, we have our session is around refugee and immigrant health services, and we have Rachel Ashby, who's program manager with the Refugee Health and TB program, here to present for us today. In addition, so she has a master's in public health with an emphasis in global health and has worked in global health and communicable disease control on the local, state, and federal level and international level for the last 15 years. She also teaches a course at the university called Refugee and Migrant Health, and is excited to present to us today. So we are very excited to have her as an expert in this area, and I'll go ahead and turn the time over to her. I'm just as a FYI, Bree McNary is going to wrap up today's meeting. I've got to hop to a meeting at the very end of this one today, so you'll see Bree at the end of this meeting to wrap up, but we'll turn the time over to Rachel.
Well, thanks for the introduction, Athena. And I'm glad to be here with you all. It sounds like you're all already pretty, well connected to resources and such in the area. As Athena said, I am the program manager for the Refugee Health and TB Control Program at the State Department of Health and Human Services. So one thing I just kind of want to start off by talking about, let me pull up my slides here really fast. I was asked to share a little bit about just the current situation with refugees, a background on refugees in Utah, and potentially some health concerns and health resources out there. So I thought I would start off by just talking about what it is to be a refugee, because to be called a refugee is one thing to actually qualify as a refugee. We often use the term interchangeably with immigrant or other visa statuses of people arriving, but to be a refugee, it's a designation that's official and based on whether or not somebody can have a proven kind of validated fear of being persecuted due to one of the five reasons: race, religion, nationality, membership in a particular social group or political opinion. And on top of that, you have to be outside of the country of your nationality. And if you have this status, you have the right to safe asylum. You have the right to not be returned back to your country if you have received this refugee status. And there are all sorts of other types of ways that people can be displaced or come to the U.S. under different ways or pathways. There's also a lot of people in the world who are internally displaced, so they may have a valid fear, but they haven't actually left their country. There's also asylum seekers who have left their country but haven't yet received that status. And there's also just a lot of people who come that are immigrants but haven't received any status, or they are potentially something like a victim of trafficking, or they are a special immigrant visa. There's all sorts of different statuses. And so I think the first thing I would recommend is, if you're working with somebody, is to figure out what status do they have, because that can determine what resources are available to them. My program works specifically with refugees and other people who have similar types of status. So refugees, people who have who are not asylum seekers but are asylees, people who are victims of trafficking, people who are parolees and special immigrant visas. And so just to cover some background on statistics on where we're at, there are more people forcibly displaced currently than there have been since we've been tracking it. There's 43 million refugees, more than that, 63 million IDPs, which is the internally displaced people, 6.9 million asylum seekers, and 5.8 others that have been determined to be in need of international protection under one category or another. And we see spikes in these numbers when there are conflicts or challenges around the world. This graph just kind of shows, when there's war, when there's a conflict, when there's a civil war or genocide, that's when we see large groups of people impacting the numbers of refugees worldwide. And most currently, we have, spikes from people leaving Venezuela, Syria, the Ukraine, Afghanistan, due to conflict and economic instability there. This graph just shows the most common demographics of people where they are fleeing from. Venezuela is the current highest number, at least as of 2024. Syria, Afghanistan, Ukraine, Sudan, we see those numbers reflected internationally and here in Utah as our top numbers. So if you are a refugee and you've fled your country, there's three options of what can happen to you. One, the situation can settle down in your home country and you can return. And this is what I think everyone, even refugees, are hoping for. You can also be integrated within the first place that you fled to. People cross the border and they're integrated into the neighboring country. Or you can be resettled to a third country. And that's where my program steps in. And that's where probably most of the people who you may be working with as refugees are under this refugee resettlement program. And this is when other countries that are not involved in the conflict say, we recognize the need to step up and provide a solution for these people who have had to flee their country. So the US every year sets a cap of how many people we are going to take in as refugees officially. I just want to note that this is not the largest way that things get resolved. Less than 1% of all refugees are resettled each year. And that's true year to year. But when we do resettle a refugee, refugees can become naturalized citizens in the country that takes them. And the people that are referred for refugee resettlement are often the people that are most at need, people who have been victims of torture or violence, people who have serious safety issues, and also many women and girls. Another thing that a lot of people don't really realize about the refugee resettlement process is just how time-consuming it is and how comprehensive it is. You have to first prove that you are a refugee. You have to show in your background why you have a fear of persecution. Then you get referred to the US. The US has the chance to say whether or not we will take them or not. They get security clearance through a lot of different agencies within the US. There are interviews. They get a medical screening overseas. They get cultural orientations, and then they get matched with an agency that's going to help them resettle in their country, in their new country, I should say. So every year, the president, in a typical year, I should say, in consultation with Congress, determines the number of refugees that we're going to receive. And this is called a ceiling, like how many is the ceiling of how many people we're going to receive. And it's broken out by region and by areas where there is the highest need. And sometimes there are special programs that resettle people quickly, like when the US pulled out of Afghanistan, we set up a special pathway for Afghans to come to the US. And when the war started in Ukraine, we saw a lot of Ukrainians arriving really quickly under what's called a special immigrant visa. So just to touch a little bit on how the policy has changed this year, on January 20th, there was an executive order that effectively put to a halt the refugee resettlement program. USRAP stands for United States Refugee Admissions Program. And so it said in the order that all arrivals were halted and that cases could come on a case-by-case basis if reviewed by the Secretary of State and Homeland Security. And also said that states should have greater involvement in determining the placement of refugees in their jurisdiction. And it also said that within 90 days, there should be a report that says whether or not resumption of the entry of refugees into the US should start again. So this really threw a lot of our work into a tailspin, right? We didn't have any more refugees arriving. We had a set amount of time that we had to provide services to the refugees that were already here. And there were a lot of refugees who had travel already booked and travel plans that had to cancel their travel plans. A lot of things have been happening since January. A federal judge did order that the government needed to restart the refugee admissions program, but even so, many cases haven't really moved forward yet. They did say that refugees who had that travel approved before January 20th can now be allowed to travel, but it's uncertain when or how this will happen. We haven't heard anything recently about how this will be enacted. There's also some individuals who are, special immigrant visas that can travel, but only on their own. Like if they can pay their own way, they can show up, they can present themselves to a refugee resettlement agency, but we don't know if they're coming or how many are coming. And so it's a little bit less structured than it was before in some ways. Another thing of note is that there was also an executive order where the Trump administration said that we would like to resettle as a nation the Afrikaner group from South Africa. These are people who are white Dutch colonists descendants. And so there have been a lot of applications received since this announcement. And the US has received 68 so far in the US, but none in Utah as of now. But we did indicate as a state that we would be willing to take them in. So we could potentially be receiving more arrivals in the upcoming months. One other thing that I just wanted to mention is that there was a travel ban on June 4th that restricted people coming from these countries that I've listed here. And I won't go through all of them, but it was detailed on who could come from where and what sorts of exceptions would be allowed. But this will even further limit who will be arriving. I do have linked here weekly updates on immigration changes under the current administration because things are changing all the time. And this link is very helpful to kind of just stay on top of who's arriving, who might be arriving, what the current situation is politically. Another thing to note is that in the US, there were 9 different NGOs that were contracted to provide resettlement services. The ones in orange were the ones that are in Utah, but each of these have branches all across the US. Here we have Church World Service is working up in Logan. So they have been doing refugee resettlement up in the Logan area. And then we have the IRC, or International Rescue Committee, and the Catholic Community Services in Salt Lake. But with all the changes this year, 2 of these 9 national agencies have pulled back from doing refugee resettlement. So Catholic Community Services is no longer doing initial resettlement for refugees here in Salt Lake. And then also the Episcopal Migration Ministries, which we don't have here in Utah, but they've also pulled back. So things are always shifting both in Utah and nationally within the last few months. Let me just pause there, actually. Does anybody have any questions so far for me? Feel free to unmute or raise your hand or type in the chat, whatever you're comfortable with. And if not, I'll continue on, but still feel free to raise your hand or unmute at any time. So just to dive a little bit more into in Utah, what we're seeing, people might be surprised by how we have quite a few refugees here in Utah. There's an estimated 65,000, but probably even more, speaking 120 plus languages here in Utah. Most are resettled in Salt Lake County area, although I mentioned that there was a new refugee resettlement agency that opened up in Logan, and a trial run of an agency down in Provo that unfortunately, probably with all of the changes that we've had this last year, we probably won't be seeing many in the Provo area. And the Refugee Services Office is a program within the Department of Workforce Services that oversees every aspect of refugee resettlement. My program is just the health aspect. You can see in the graph here that there was significant decrease in refugee arrivals in the previous Trump administration in 2017 through 2020. And then a large increase again with the Biden administration, and we're going to go back down now with the Trump administration again. In previous years, it hasn't been quite so partisan, and both Democrat and Republican administrations had refugees in pretty even numbers. This just shows you who we're seeing in the refugee resettlement program. Again, this doesn't cover all types of immigration. So this is just those who qualify as an official status. But we do, in 2024, we saw the most people arriving from Afghanistan, the DRC, which is the Democratic Republic of Congo, Venezuela, Cuba, Ukraine. And relevant to this group, 65% of our arrivals were younger than age 30. We do have a lot of children arriving, because those are the groups that are often presented as those that could benefit the most from refugee resettlement. A lot of people arrive in family groups, but there's a lot of children in the family. So there's, 1 adult or maybe 2 adults and quite a few children. And our top 5 languages are Spanish, Dari, Arabic, Kiswahili, and Pashto. I want to go a little bit into what services are provided to refugees when they first arrive through this official refugee resettlement program. There are the 3 agencies that I mentioned before: IRC, Catholic Community Services, and the CASH Refugee and Immigrant Connection is the one up in Logan. When refugees arrive, they have a lot of hands-on support right at the very beginning. They get picked up from the airport, taken to an apartment that's been simply furnished for them. They are given a culturally appropriate hot meal when they arrive, which I think is a nice touch. They're set up with food and clothing. They're given orientations on their area, their neighborhood. They're given case management services. And so it really is with the intent to help people get set up on their feet quickly. They're also helped to get set up for Medicaid, Social Security, they're given assistance looking for jobs, developing resumes, helping kids enroll in school. They get interpretation and transportation to health screenings and any follow-up care appointments that they might need. And then when you come through the official refugee resettlement program as a refugee, you are required to get a green card after 1 year, and you are eligible to get citizenship after 5 years. And so there's assistance provided for those immigration services as well. So these agencies really do a lot of work, and they do a lot of good work to help people become productive and integrated quickly. Since I am with the Department of Health and Human Services, I want to spend a bit of time talking about the health impacts of displacement. As you can imagine, being a refugee means that you've kind of encountered some difficult situations. At the very least, you've had to leave behind all but a few of your possessions, and you've been traveling for long distances in potentially unsafe conditions. You're often cut off from your support networks. Families can be separated from each other. You're often in places where you can't speak the language. It's hard to connect with services or even be eligible for services sometimes. A lot of times there's vulnerable groups who aren't able to undertake these journeys safely and can maybe be left behind to fend for themselves, or if they do travel, they encounter their own difficulties. Even if they make it to a refugee camp, there's limited water and sanitation, limited food. As I mentioned, communication barriers. It can be mentally and emotionally draining, and when they're in camps, it can be vulnerable to epidemics and things that make their health at risk. And I think it's important to note that the majority of people who have an official refugee status and are like waiting in refugee camps to figure out what's going to happen to them, a lot of times these people are in what's called a protracted refugee situation, which means that they've been in a different country for more than 5 years, but without being resettled, without having any sort of solution to their situation. So when you're in a camp for 5 years, a lot of health concerns can pop up. But one thing about the official refugee resettlement program that I think a lot of people don't realize is that refugees all get a health screening overseas before they arrive in the US. And this is specifically, the primary focus is to make sure that there are no communicable diseases that were going to be introduced into the US by bringing people here. And so it is a comprehensive health screening, but it isn't as focused on chronic conditions as much. It's mostly focused on making sure that, they don't have active TB or they don't have other things that need to be resolved before they travel. And it's a clearance that's given and it expires every 6 months. And so if for some reason their travel's delayed, they have to have a health screening again. I won't get into too much about what the different classifications mean, but if you have what's called a Class A condition, it means that you can't travel until that condition has been resolved. And so this is things like active tuberculosis and syphilis and Hansen's disease, but can also be things like if you show that you have a drug addiction or violent tendencies. If you have a Class B condition, that means that it's something that should probably be followed up on, but you can travel. And so part of our role here at the state is to keep track of these people that are arriving with Class B conditions and make sure that they get connected to care. So this most commonly is things like latent tuberculosis, where it's not infectious. There's no reason why they can't travel, but it should be followed up on when they get to the US. But there's a number of other Class B conditions. We get all of this overseas information through a database run by the CDC. And so we get kind of a heads up before people arrive to see if there's people who are going to need extra support or have concerns that we need to help with. So then another part of what we do here at the state with refugees is we make sure that following this overseas medical screening, they also get a domestic screening once they arrive here. This is supposed to happen within the first 30 to 90 days of their arrival, and it's much more comprehensive than the overseas one. This one is looking more for chronic conditions, mental health concerns, things that may not have been a concern to prevent them from traveling, but we want to get them well set up with medical care here. We give follow up on immunizations that they might need. And if there are concerns, if they have, dental issues, or if they have nutrition concerns, we refer them to specialists that can help them. And if you're interested, there are guidelines put out by the CDC on what all do you screen for. You can see that we do screen for infectious diseases, but also just chronic conditions as well. Testing is tailored to age, country of origin, what countries might have a risk for different things. And I just want to mention too that we contract with specific clinics throughout the state to do these refugee health screenings. Because it can be kind of overwhelming if a refugee just shows up to a normal clinic who's not prepared to deal with services in another language, or may not be familiar with some of the risk factors that people might have based on what country they're coming from. So we have a number of clinics in the Salt Lake area. We have a clinic in Ogden, and we have a clinic in Logan area that we work with. Some other things that we do at the Department of Health and Human Services, we monitor all of the health screening results so that we can see, trends and needs for refugees that are arriving. We monitor the follow-up of latent TB, making sure that people complete their latent TB treatment. We also help coordinate and refer people for mental health referrals. Mental health is one of our most common conditions that we see, or not conditions, but concerns that we see when people arrive.
Rachel,
Yes.
looks like you had a question. So do you mind
I
if we,
didn't see.
I saw a hand up. Now now I don't see it anymore, but
Oh, sorry, Athena, that was me actually.
Liz. Okay, great.
I just had a quick question about now you mentioned when some of these for our program, these Afghan nationals, they have their SIV visas, and I've met a few families who have borrowed money and come on their own.
Yeah.
And are they still getting screenings when they arrive here?
Yeah, it's tricky because they're eligible for a screening, but I don't know if they always know that they're eligible for a screening. And so since they're coming on their own, we don't know about them ahead of time. The normal process is we know about them ahead of time. We have people that reach out and connect with them and get them to a health screening. But when they come on their own, we don't know if they're coming. So
that's good to know. So is that something that would be for me to pass on, that they're eligible for this? And would I make that, or I would contact a resettlement agency, or how would that go? How would I go about that?
Yeah, I would say you could contact a resettlement agency or contact my office. The one caveat is that things are more strict right now than they have been in the past, and we have to get them in for a health screening within 90 days of their arrival for them to be eligible for us to pay for it. So if you would want to double check that and say, when did you arrive? And if it's within the last 3 months, then yeah, I would say connect to them with our program and we would see what we could do.
Okay, perfect. Thank you.
No, thank you for asking that. Because yeah, it's an interesting situation where we know that they might be coming, but we aren't sure where or when or how many people. And it's only if they hear about our services that we can help them in that situation. Yeah.
Okay, great.
So the other thing that we do at the state is we do have contracts with the different resettlement agencies and clinics and mental health agencies to provide the health screenings, to provide the mental health follow-up care. We also contract with IRC and CCS and the agency up in Logan to provide health promotion. And I'll go a little bit more into that, but those are really important educational opportunities that we can give to refugees arriving to just kind of orient them to our healthcare system. And then we also coordinate with other state refugee health programs. So there's somebody in my position in each of the 50 states, and we have regular calls to kind of coordinate what are we seeing, what trends are there, especially in times like this where it's a little bit out of the ordinary and people are arriving in different pathways. It's helpful to hear what's happening in other states. So I do kind of want to go over some of the mental health resources that we work with. I'm sure there are many more out there that would be great. You all were mentioning some resources that you guys already know. But we work with the Asian Association of Utah and Thrive Center for Survivors of Torture. Both of those have been agencies that have been for decades, worked with people who have been victims of torture and violence. And so they are very unique in the services that they can provide. And then recently we've been working more with Journey, Center for Behavioral Health. They're a newer organization, but they also are familiar with all of the complexities and nuances of the refugee pathway and the mental health load that can carry. We've also made referrals to the Children's Center, which you guys mentioned earlier, the Family Place, and Wasatch Behavioral Health, and also put out a plug for the 988 line that you guys mentioned. And just to talk a little bit about some of the health promotion and education that we contract out to provide to newly arriving refugees. There are classes that go over how to integrate into our medical system, which is, as everybody knows, a complicated system. And this is important because a lot of refugees, depending on where they're from, some refugees have very high literacy levels, some don't. Some are literate in their own language, some are not. And so when you get to the US and you get a bill in English or a letter from your insurance company, it can be very hard to know how to navigate that. There's also many people who are arriving with very complex medical needs and need help figuring out how to get to their nearest clinic. Language barriers, a lot of we let them know that they have a right to healthcare in their own language, whether that's in-person interpretation or over the phone interpretation. They also help provide them transportation to access healthcare, at least for the first little while they're here. And every country has its own way of kind of managing health and wellness in a culture, and so just understanding what that looks like here in the U.S. So classes cover how to schedule health appointments, how to get referrals to a specialist, how you have the legal right to interpretation, how to even fill a prescription. That is different in different countries and might not be intuitive to people when they first arrive here. I also talk about health insurance and how Medicaid works, how you can ask questions to your health insurance company. They talk about what is the difference between your primary care provider versus an urgent care versus an ER, because a lot of times we see that refugees just go to anywhere that looks like it might be providing medical services and not realizing how it isn't always that simple. And then we also do bus orientations, actually, bus and tracks orientations, where we teach people how to use public transit to get to where they need to go. So I think these are really important and helpful. I did also want to mention this. We have, well, I'll get into that later, but we actually have been passed by the state legislature to talk about female genital mutilation and cutting, and how this is a significant public health issue that isn't normally seen in our demographics here in the US, unless they're people coming from other countries. It predominantly affects refugee communities, especially populations from East Africa, where this is very prevalent. But it's estimated that about 1,200 girls are living with FGM in Salt Lake City alone, not considering the rest of the state. And that there should be extra care and attention and screening for these populations that are at risk in this area. So I don't know how many of you are working with these populations or with a group that may be at risk, but in case, I just wanted to mention that this is something that you could have on your radar of something that may be happening. We are also tasked as our organization to develop an education program around this. And so if you're interested in learning more, this is a flyer from last year, but we're going to be developing another workshop. And so if you're interested in being in touch about learning more about female genital mutilation and cutting, we'd be happy to add you to our information and training outreach. So we are tasked by code actually to make it known that it is now illegal to perform FGMC either in the US or to send girls back to their home country to have this performed on them. So there's QR codes that you can scan to get more information. I know that you guys talked about this a little bit at the beginning. Athena already mentioned the World Refugee Day, but I just want to put in another plug for that. So that's this Friday, and it's always a really good time. They have dancing and music and food trucks by people who are of refugee background, and people are, sell their artwork or things that they've made, and it's really a great time. And we have a health fair that our program has helped put on. And so I would encourage anybody to come and spread the word. There's also lots of ways that you can help, and I'll be sending out these slides, so I won't go into this too much right now, but if you're interested, there's lots of ways that you can get involved, and I've put in some links to things there. And so the point that I want to end on is just that I think I'm a little biased because I work in this program and with these individuals, but I think that this quote is really great where it says, to be called a refugee is the opposite of an insult. It's a badge of strength, courage, and victory. And so I think just to keep that in mind as we're working with people who come from different places, that they've experienced a lot, sometimes even, violence and hardship, and have made their way in hopes of a better life. And it can be very political, and there can be lots of different ideas on how this should look. But when we work with individuals, I think it's important to recognize what they've gone through. So thank you for letting me take the time to talk. I see that Naomi, you have your hand raised. Do you have a question?
Hi, thank you for your presentation. That was really informative.
Great.
I'm interested to know if a Marshallese family can participate in your citizenship program, and a little bit more about how that program works. And I understand that Marshallese aren't considered immigrants or refugees, but could they possibly still participate in that resource?
That's a good question. Not of the ones that I work with most closely. There might be other programs out there though, because the immigration services that I work with, I would say you could potentially reach out to Catholic Community Services. They have a immigration support program that's really helpful. And I know that most of their funding is specifically for refugees and other designated visa types, but it's possible that they might have resources that they could share. That would be my first suggestion.
Thanks.
Any other questions or thoughts or experiences you've had, or anything that we can discuss?
Rachel, this is Eric with Integrated Services. I just wonder if you'd elaborate just quickly on why it's so important that some of these refugee resettlement agencies have kind of backed out of the picture, or when these folks come, like we have some Afghan refugees showing up they do have a special immigrant visa, but they're not coming through resettlement agencies right now. And kind of what the implications and challenges are, with those families besides, not having an organized process when they get here. I mean, what does that mean for those families?
Yeah, I think one of the strengths of the refugee resettlement program is that refugees are given a lot of resources, and it helps them get set up on their feet quickly. They get, kids enrolled in school and connected with potential job opportunities. And when they aren't coming through the official process, I think a lot of that information gets lost, that things that they're eligible for. So if they do come across to your clinics or across, your realm of influence, I think it's important to just get people connected, because there might be ways that they can receive help that they're not aware of. Did that answer your question, Eric, or is there more I can?
Did, and it was a leading question because I wanted to say that here at Department of Health and Human Services, through our Integrated Services program, we receive a grant through RSO, so Refugee Services Office, that comes out of the Office of Refugee Resettlement, so federal monies. And we are tasked, our care coordination team, our Afghan refugee early childhood care coordination team is charged with working with families who have children ages 0 to 5 who are ORR eligible, So that means that they have a special immigrant visa. And we are able to help those families make some of those connections to early childhood education, medical type services, and those supports to get those kids ready for kindergarten. And our care coordinators can also help send those families to Refugee Services Office to make sure they can connect with some sort of, other types of support to make sure they can get help with, housing or other types of, you know, uh, services that will get them established a little bit better to help them, get connected with work and other things. My team does not do those actual types of work related things. We're charged with only working specifically with getting those kids healthy and prepared for kindergarten, but it is a whole family approach to a certain degree, and we can definitely make those appropriate referrals to get those families into uh, the appropriate offices to get them connected with those other family type services. And one caveat here is, though, the family has to reside in Salt Lake County. So we don't have statewide support for that. Our grant only supports families in Salt Lake County. And that was a big blurb I just threw out there. But you can reach out to us if you do have families coming across any of your practices and they have young kids, and they are Afghan families, and we can do the determination on our side of things to see if they're eligible for supportive services. If not, we would refer them over to Carrie Martinez's preschool development grant program, and they are amazing with that type of help and support that they can offer. And if they have children with special healthcare needs, we can also help them with our program, our children with special healthcare needs care coordination as well. So there are some ways we can go about doing that.
Snap, Eric. Yeah, I'm glad you have that ability to help in that area. Any other comments or questions? All right.
Awesome. Well, thank you so much for sharing. If nobody has anything else to add, I am going to just share some closing slides. All right, here we go. So next meeting will be July 16th. We'll be talking about intellectual disability and co-occurring mental health illnesses. And you can always message any questions or anything you want to collaborate on to this email, our listserv. And we also have a UCCCN Facebook group for collaboration as well. So you will see resources and recording from the meeting from Athena sometime this week. And if nobody has anything else to add, hope you guys have a great rest of your week. And thank you so much for sharing.
Thank you, Bree, and thank you, Rachel. We appreciate the information today and all the terrific work that you do out of Refugee Health, and just making sure that our arriving families are safe and healthy and ready to get moving on their adventure here in the United States. So thank you for all the amazing work that you do.
Yeah, thank you. And thanks to all of you who are out there on the front lines, really, of meeting patients. We kind of are higher in terms of administration, but I mean, we don't put our hands on the patients as much. And I really admire those of you who do and put in that hard work. So thank you so much for all that everyone on this call does.
Thank you.